And welcome back, and thanks for staying with us here on Morning Live. Now, today, the United Kingdom, the World Health Organization, and the South African government will co-host an event at the UN General Assembly to discuss the crucial issue of ensuring access for all countries to a COVID-19 vaccine. And over the weekend, the UK government announced its contribution of up to £500 million to the GAVI COVAX AMC funding. Now, to discuss this further, we're joined by the British High Commissioner to South Africa, Nigel Casey. Thanks so much for your time and welcome to Morning Live once more.
Good morning and thanks for having me on the show.
Commissioner Casey, if we could just start by just taking a look at an explanation of what exactly this GAVI COVAX AMC is.
Yeah, so look, in essence, this is a big international fund to create huge international purchasing power to procure vaccines, therapeutics and diagnostics to help us all combat COVID at the most affordable price. We know that if you buy together in bulk, you have greater purchasing power, you can keep the prices down to a minimum, and you can incentivize the companies producing these vaccines and treatments to produce them at mass scale quickly.
And of course, this is a very important subject because the world right now engaged in talks about if and when a vaccine is found, whether there would be equitable access for all countries, all nations to that particular vaccine. So in terms of the UK, please talk to us about your outlook on this particular matter.
So we've learned from previous international public health crises that there's no point in treating an international virus or disease in one part of the world and letting it go unchecked elsewhere. It simply comes back. And so successful international efforts to combat or eradicate diseases have been global. And we know that it is essential that we in the rich world support every country around the world in its efforts to combat coronavirus. That's in our own interests. So the case for an international facility like this is quite simple. It's there to create a pooled fund to make sure that everybody can afford vaccines, treatments, diagnostics when they're available.
And the fear is, of course, that some of the richer countries have already indicated that they would approach this a little more selfishly, if you will, in terms of securing for themselves, their own nations first, some of the vaccines that may come online first. And this is a real worry for the rest of the world and poorer nations in particular.
Well, it would be a worry if there was a finite supply of these vaccines, and so that if rich countries bought X percent, there would only be Y percent left. But that's not actually the case. And one of the things this COVAX facility is designed to do is to drive up the manufacturing capability around the world to produce vaccines and other treatments at scale in far greater numbers than can be done right now. So there isn't a finite amount of the vaccines which, when purchased, will leave nothing for anybody else. This is about creating the capacity to produce vaccines that work for everybody, everywhere, at scale.
And with regard to that race, we know the UK were right up there alongside nations such as Russia and China. So what is the latest coming out of the UK with regard to a vaccine and the prospects of when it will be available?
Well, the Oxford AstraZeneca trial, which is the one best known here because it's being done in partnership with WITS, is well advanced. It's going well. It's in the phase 3, which is, as you know, these new vaccines typically have to go through 3 phases of trials, with the 3rd phase being the most important and the largest. Phase 3 trials have been restarted in the UK and South Africa and elsewhere. As you remember, there was a brief pause to check on the safety of the vaccine when one of the volunteers developed an illness. It was turned out that wasn't related to the vaccine. So the trials are continuing. They need coronavirus cases to test the efficacy of the vaccine, and obviously, the incidence of the disease is thankfully coming down here in South Africa. So it'll take a little while yet to finish those phase 3 trials, and we're not going to rush to failure. We want these vaccines to work everywhere, and to give the public confidence that they're safe to use. So we don't see this as a race to beat other countries. We see this as a race to create a safe vaccine for everybody that can be rolled out around the world.
And with regard to the AstraZeneca-Oxford trial in South Africa, have you had opportunity to look at how perhaps we fared thus far, some of the results coming out of that?
Yeah, we talked to the people that's who are running the trial. They're happy with the progress of the trial here in South Africa, as are we in respect of the trials going on in the UK and Brazil and the US. Good progress is being made, as I say, against the background here in South Africa, thankfully, of the virus decreasing in its incidence. That creates a problem for the trials because, as I said, you have to those vaccinated need to come into contact with coronavirus to prove the vaccine's efficacy. So it'll take a little while longer yet. We hope that by later this year or perhaps early next year, the full phase 3 results will be available. And as I said, we're not going to rush through licensing and ignore proper regulatory steps in order to get this drug to markets. It needs to be ready, it needs to be safe and proven to work everywhere.
And of course, then, High Commissioner Casey, there is the question of affordability. And we did see that pledge over the weekend by the British Prime Minister, Boris Johnson. So talk to us about that and how this is likely to help in making sure that the vaccine will be available to everybody.
So the purpose of this facility called COVAX, which is being put together internationally and which we're trying to seek international support for in the event today in the UN General Assembly, is to create a pool of funding so that the poorest countries, the lower income countries, lower middle income countries can afford the vaccine when it is ready. There are about 92 countries in that category. They need an estimated 1 billion doses by the end of 2021. And we need to provide the funding because we recognize that they don't have that from within their own resources. So this is why we put £500 million into that facility. And we're looking for others to put similar commitments on the table today and in the next few weeks to make sure that countries all around the world can be assured that their citizens are going to be able to get vaccinated when they need it.
And then just as we wrap this up, High Commissioner, the talk around tourism and that particular sector opening, well, there has been a lot of criticism of the UK abroad and within the UK itself about how it's handled this coronavirus. South Africa, every country, I suppose, will be criticised for the way in which it has handled this pandemic in one way or another. But if we look at the international tourism and borders opening up right now, can you give us a bit of an indication as to the UK's outlook on this particular matter at this stage?
Well, the UK took a different approach to South Africa and some other countries. We have never closed our borders at any stage in this crisis. The way we have managed the public health risks arising from travel has been through our quarantine policy, which is our self-isolation at home in practice policy. So if you're coming from a country with higher incidence of coronavirus than the UK, you're going to have to do 14 days self-isolation on arrival. But we've never closed our border, and we've felt that that's been an important principle. It's helped sustain our economies through this difficult crisis. And so we're listening out with keen interest for the announcement that the Transport Minister is due to make this afternoon on what South Africa's border opening means. That we are keen to support South Africa's tourism industry in a way which is safe. And so we're looking forward to doing that. But obviously these decisions are for national governments, and we recognise they're difficult.
And I guess there is a bit of concern as to what preparations are in place to ensure that UK citizens, for example, do not bring the virus to South African shores and vice versa.
Well, you have pretty robust mechanisms in place already. You have your own quarantine policy. So if you come to South Africa at the moment, you need to spend 10 days self-isolating. So that substantially reduces the risk. And under the new regime that we understand is being introduced from tomorrow, you will have the option of either the 10 days self-isolation or taking a test within 3 days of travelling. And either of those routes offers a substantial reduction in risk of importing cases from overseas. So that's what we'd like to see. We hope to see the border is reopened, even if measures like that to contain and reduce the risks are kept in place.
And just very briefly, is there an indication that people are at this point, looking to travel to South Africa, for example? Because I think we're all suffering from a bit of cabin fever from the lockdown.
I have people WhatsApping me several times a day, every day, asking if there's any news. I know there is demand. There is particular demand from the very large number of Europeans who have second homes in South Africa, who will have a higher risk tolerance, and I know will come back if they're allowed to, and they will spend money in South Africa this summer. So I hope that group of people, the business travellers, people with long-term types of long-term residency are able to come back, because I think it's important to support South Africa's economy, and I know that there is demand there.
Thank you so much for your time this morning. British High Commissioner to South Africa, Nigel Casey, talking to us about their call together with the WHO and South Africa for universal access to a coronavirus vaccine, also some of the other attendant issues around that, and of course travel and tourism. And as the High Commissioner said, it's about waiting to hear that announcement by the South African government regarding those travel arrangements and who will and who will not be allowed in, Leanne. I know you're also very keenly interested.
Very much so, and I think so many people are, because not only necessarily for travel purposes, it's also family that have been stuck in different parts of the world that have not been able to get back, because repatriation flights are very, very expensive. So I think they're waiting to find out, can we come in from this country? What is it going? How are we going to do it? How are we going to book? Because this opens tomorrow, and we still don't know any details. So, do we know as a fact that there will be a press conference called today?
As far as I know, there will be an announcement later today.
Yes, it has been cancelled, but it's got to come today.
As far as I know, it is taking place later today. So so we will be keeping an eye out for that, because I think many people keenly awaiting the announcement of the countries that will be on the list, etc. But it's going to be very interesting. But that's where we're going to have to leave it for today. Our time is up.
It is.
Do take care. Be safe, especially here in Johannesburg around